and Matter podcast, we learn together from the best scientists and thinkers alive today about how your mind-body reacts to what you feed it. Before starting Mind and Matter, I spent 10 years in academia doing scientific research. I got a PhD in neuroscience from Harvard University, where I focused on neuroendocrinology and the neuroscience of behavior. And before that, I specialized in molecular, developmental, and evolutionary genetics. I use my scientific background to parse and translate the information guests share on the show. And in addition to the podcast, I write long-form content and send out a free weekly newsletter at the Mind and Matter Substack at mindandmatter.substack.com. I also offer private, science-based health consulting, where we work one-on-one and apply the same rigorous, evidence-first approach you hear on the podcast, but personalized. We can obtain and analyze your biomarkers, work on diet and behavior strategies, review supplements and drugs that you might be taking, or anything else related to general metabolic health. So if you'd like more tailored guidance on your personal health, head to nickjikomes.com and fill out a short form or book time with me there. A great way to support my content in all of its forms is simply to visit mindandmatter.substack.com. You'll find a link to that in the episode description, and you'll also find a link to my current affiliate partners through my support page. These are products that I use myself that relate to physical, metabolic, or mental health. For example, one product I use every day is the AquaTrue water filter, which removes heavy metals, microbes, endocrine disruptors, you name it, so that you have higher quality drinking water. All of those links for health consulting, for my affiliate partners, and the Substack page are all in the episode description. So thank you very much for listening, and don't forget to check out mindandmatter.substack.com for all of my content. Rahi Sarbaziha, thank you very much for joining me.
Thank you. Thank you for having me.
Do you want to just take a second to briefly tell everyone a little bit about who you are and what you do?
Yes, I'm a medical doctor based in Beverly Hills, and I focus on beauty, health, and wellness. So a lot of regenerative aesthetics and hormones, wellness, peptides, weight loss, muscle building, just overall vitality.
Yeah, and so today we are going to talk mostly about peptides and GHK-Copper with respect to skin health and skin biology. So starting pretty basic here, can you just talk a little bit about the extent to which naturally occurring peptides are an important part of normal skin health and skin biology?
Yeah, sure. So peptides are naturally occurring in our bodies. And I know like the term peptide, now everyone's talking about peptides, but they've existed in our bodies forever, obviously. And so we have naturally occurring peptides, and then there's synthetic peptides as well. Peptides basically act as messengers, so they deliver signals to other cells to perform certain actions. And
one of the peptides that people are talking a lot about these days, it's becoming increasingly popular, is called GHK-Copper. This is apparently an endogenous peptide in our own bodies, but what exactly is this peptide, and what is the significance of the copper part?
So yeah, the peptide part is the GHK and the copper is the ion. So, and then together is how they are transported throughout the body. So GHK-Cu, so there's 3 amino acids, and it is naturally occurring within our bodies, GHK-Cu. And so it has, and studies have shown that it has so many different benefits for hair, skin, nails, but not just that. It goes even deeper. There's benefits associated with like neurologic and even tissue repair internally, lung repair. So it's not just an aesthetic thing, GHK-Cu. So GHK stands for glycyl histidyl lysine. So 3 amino acids together, and then with the copper make up the peptide GHK-Cu.
Yeah. And so this is it's an endogenous peptide. It's inside of us. And my understanding is basically, it peaks in young adulthood and then declines with age.
Exactly. And that's just basically almost with every peptide that's occurring in our bodies.
Yeah.
It peaks and then it declines.
And do we have a good sense for what endogenous GHK is actually doing specifically within skin in particular?
It participates in wound repair, participates in collagen regeneration. It helps with angiogenesis, which means blood vessel formation. So those are the main things that GHK-Cu participates in.
And so there's many different ways that people use skincare products and stuff. With the peptides in particular, right? There's topical application of some of these peptides like GHK-Copper. There's also injectable versions. I want to get to some of that, but stepping back for a second, when we just think about topicals for skin health, right? Facial creams, moisturizers, all of that stuff. It's a huge industry. Lots of people use lots of these things. When we put stuff on our skin, how much of that is going to get into the skin? And what are the major factors that determine how much of the active ingredients can actually penetrate the skin barrier and get into our tissues?
Well, there's so many different factors that can actually affect that. And it depends on it varies person and also what you're putting on your skin. So the size of the particle itself. So for example, if it's less than 500 Daltons, it should be able to be penetrated within the skin. And then the ability to be lipophilic. And then other factors too, like how, if there's any medications affecting the skin, if you've put on any different type of solvents or anything that can help your skin penetrate it. So it varies for sure.
Yeah. But basically the size of the molecule matters. Smaller things will tend to penetrate better.
Yes.
Fat solubility and how much they dissolve into fats matters.
Exactly. So exactly. And it varies person to person and it varies product to product. Exactly.
For GHK-Copper in particular, when it's topically applied, does that have good penetration or does it require like other factors to be alongside of it to help it penetrate the skin?
It'll penetrate because it is a small enough molecule. But it is better if it's combined with an aesthetic procedure, such as microneedling, fractional laser, really anything, even microcurrent, injection, which we're talking about mostly topical right now. But it is better if it's combined with a procedure that kind of compromises the skin barrier to allow the GHK-Cu to penetrate deeper.
And so from your role, working directly with people that are using GHK-Copper peptides topically and other related things, in general, what are people using this for? And in general, where do we tend to see the benefit with respect to skin biology and skin health?
Well, the thing about GHK-Cu, it has so many different benefits for skin and hair. It helps with fine lines, wrinkles, pigmentation. It'll help thicken the skin. It'll also help strengthen the hair shaft if used for hair growth. So there's multiple benefits. So in general, most people use it as an anti-aging tool in their skincare toolbox.
Mm-hmm. And so this is how people are actually using it. Is there any clinical data on this where people have carefully studied it in a clinical trial setting or anything like that?
Actually, there's so much on GHK-Cu. When I was writing my article on, basically, it's a meta-analysis of all the different articles out there on copper. And it was fascinating. There's so much out there. There's so many studies that show how effective it is for any type of anti-aging, but also wound healing as well. There's a ton of studies that support the use either in conjunction with hyaluronic acid or on its own. It is extremely effective.
Yeah. I did read that it can work in conjunction with hyaluronic acid.
Yeah.
I'm familiar with that term. I've seen it, on products and talked about, but I don't really know what it is. What is hyaluronic acid and why is that in so many products?
Hyaluronic acid is an essential component of our skin, joints, and even our eyes. And it occurs, it's located within the dermal layer of our skin. And it basically is what keeps our skin hydrated. It attracts water and it helps keep us hydrated. So that plump looking, like a baby, when they have that plump skin, that's lots of hyaluronic acid. So hyaluronic acid is also used in traditional fillers, in lips, cheeks, etc. So hyaluronic acid is a very important component to keeping us looking and feeling hydrated as well.
Mm-hmm. And so I want to get into a little bit sort of the mechanics of what we know is actually going on under the hood here. So GHK-Copper, when it gets into our skin, when it gets into our bodies, I know that it affects things like oxidative stress and inflammation. Do we know much about what it's actually doing and what its major mechanisms of action are?
There are so many different mechanisms of action of GHKCU. That's the thing. I'd have to actually review that because there's just so many different things that it does. It helps stimulate glycosaminoglycan production. It helps upregulate fibroblasts, vascular endothelial growth factor. It works through various different mechanisms. It's not just one.
Yeah.
And that's what makes it, that's why it has so many different effects in the body. And it has so many different benefits in the body because it just has such a wide range of actions. It also like modulates gene expression as well with regards to tissue repair. And there's just like a list of different genes that it can affect.
Yeah, I was doing a little bit of reading ahead of this, and yeah, it seems to have acute effects, like it's acutely, helping with oxidative stress, basically. But it's also, like you said, affecting gene expression of a bunch of genes. And what's interesting about that, or where I want to go next with that, is this would imply, I would think, that it has not just acute effects right now, but it could potentially have lasting effects that persist beyond the presence of the actual peptide itself. When you see people use peptide for skincare, do they see effects that sort of outlast the actual peptide being present? Do they use it for a few days or a few weeks and then continue to see changes in their skin?
Absolutely. That is definitely what will happen when you use GHK-Cu, because the whole point of regenerating collagen production or upregulating gene expression, it's not going to be something that you apply it and you consistently apply it for, let's say, a month, and then it'll work to upregulate these genes and also stimulate this collagen. And that's going to take months to actually come to fruition for you to notice the difference.
I see. So this is the type of thing where, despite any acute effects it might have today, you're going to need to use regular application or administration of this substance somewhere or another, because some of these changes, such as modulating gene expression, take days or even weeks to sort of unfold and reach a new steady state.
Yes. And that's basically the whole basis of regenerative medicine and integrative aesthetics is, doing things today and where you'll see results in 3 months, 4 months, 6 months, up to a year. That's basically just the premise of the way aesthetics is heading.
Mm-hmm. And so GHK-Copper is getting quite a bit of attention recently. It almost seems like a new thing, but apparently it's been around for quite a while. How long has it been around and known?
Yeah. Well, I mean, it's in our bodies, so it's been around as long as we humans have been here. But it was discovered in 1973 by a scientist, Laurent Picard. And he isolated it, GHK-Cu, and that's how we know of GHK-Cu. But it's been occurring it naturally occurs in our bodies.
Yeah. So it's naturally occurring. It's always inside of us to some degree. It was discovered by scientists in the 70s, and so we've known about it for decades. For sure, yeah. And I guess maybe I can ask another question, like, why is it becoming more popular now? And I think just the realm of regenerative medicine is becoming more popular, and people are learning more about peptides and wellness, and people are taking more charge of their health and wellness. And that's why things like GHK-Cu are becoming more talked about. Yeah. And then how critical is the copper ion? Is GHK always GHK-Copper, or is GHK, can it stand alone and be used without the copper? And does that make a difference?
Well, the whole point is the copper. The GHK is what helps it transport throughout the body. Copper on its own is actually if it's copper on its own without the GHK, they need to work together is what I'm trying to say. If it's copper on its own without the GHK, then you can have actual oxidative stress with that. It can cause oxidative stress in the body. So it's kind of contradictory. It kind of almost makes no sense, but together as they provide a synergy that provides the benefits. But then there is another compound. It's AHK Cu, which has been studied, alanine histidyl lysine copper. And that has been studied specifically for the hair benefits. Although GHK can also provide a lot of hair benefits too. So I think they definitely overlap, but you want them together, not separate.
Got it. And so people are using this topically in the form of like serums or creams that you just put on your skin. But they're also using it in other ways. In peptides, including GHK, apparently are injected. Do you have any experience seeing, these different routes of administration with patients? Do they make a difference? Do you see different effects if you inject it in the skin versus apply it topically?
Yes. So I must say it is not FDA approved for injection. However, people do inject it. And although there aren't many human studies out there, so this is just from my experience and from the experience of other providers that I know, but in general, injectable is going to be a little bit more effective. Again, it depends. For example, if you're doing hair and you inject the copper GHK-Cu in the scalp, it can be a little bit more effective than topically. But if you're doing topical, you want to do something like microneedling prior. However, unfortunately, there aren't many human studies on this, or any really. When I was doing my research, there are very few to none. And in addition to that, it is not FDA approved, but are people doing it? Yes.
Yeah. Yes. People are definitely doing it. I would imagine, right, if you're just injecting it under the skin, I mean, you're getting more of it down into the skin, topically applied, no matter how bioavailable it is, it's probably not all penetrating. So the next question I have about injections versus topical is the effect highly localized, or when you inject it, is it also going systemically? And is there any reason to think, is this working mostly in the skin, or is it going to be having effects on other tissue systems that, when you inject it, it's going to go systemic and, potentially have effects outside the skin and other tissue systems?
It's for sure systemic as well as localized. A lot of times when you inject peptides, let me give you an example of a very well-known peptide that most people don't even know is a peptide. For example, insulin. A type 1 or even a type 2 diabetic will inject it. They don't necessarily inject it into their pancreas. They'll inject it to the back of their arm or their abdomen, but then the effect is systemic, right? And so that's the same for other peptides too. However, some people will inject it in the area of concern because it will first go through that area. So for example, the hair, the scalp, you'll inject it in the scalp, but it also goes systemically as well.
So it makes sense. It's higher at the site of injection, but it will go systemic. Lots of peptides work this way. Makes perfect sense. And then when I kind of think about the basic biology that we briefly discussed, and I've looked into a little bit, GHK-Copper is having effects on oxidative stress pathways, on inflammatory pathways, and copper itself is really important for just metabolism in general in all of our cells. So I would imagine that GHK-Copper is probably having effects anywhere that it goes in the body.
Anywhere, exactly.
Yeah. Do we know about any specific effects or benefits it's having outside the skin that are worth talking about?
There are actually a lot of studies showing that copper GHK-Cu can help with other conditions. I kind of went over it a little bit earlier, but certain cancers, specifically when I was writing this article, I really did focus on the aesthetic and wound healing portion of GHK-Cu. However, if you look at the research being done, there's a lot of, benefits for lung disease, specifically COPD, certain cancers, specifically colon cancer, but there are other cancers out there. So there are a lot of different disease states that GHK-Cu can benefit. But obviously we have to be mindful not to overdo it as well, because then there could be copper overload.
Right. Interesting. So I wanted to ask you about that. Is there any risk of side effects or negative effects from disrupting copper homeostasis or delivering too much copper via GHK?
I think again, there's really no studies showing this, because there just unfortunately are not very many human studies, and there should be, because there's so much potential for peptides, and there's so much potential for specifically GHK-Cu. But there is a disease called Wilson's disease that has an issue with copper metabolism. But I think that it is, you have to have this liver issue where you can't metabolize it. Otherwise, I think your body will metabolize it. And with peptide, you cycle on and off. So you're not going to be injecting it every single day, 12 months out of the year. You're going to cycle on for like 1 or 2 months and then you'll cycle off, give your body a break. So I haven't really heard of anyone overdosing. That's just theoretical. And also knowing that there is that Wilson's disease where people can't process copper well in their bodies.
Got it. So there's a theoretical potential here, but no one's really observed anything yet. But it's also not particularly well studied in this regard. On the topic of cycling and injection protocols, can you just say a little bit more about that? It sounds like you said, typically people are going to be using this, for 1 or 2 months at a time. What would be the approximate dose and number of injections per day and the total length that would be a typical cycle that someone like you sees with the people you work with?
So the dosing isn't really standardized for copper. I would have to like review the dosing protocols, to be honest, because I don't have the dosing on the top of my head and it is not standardized. But it is usually injected in micro doses, like micrograms daily, usually 5 days out of the week. You take a few days off and then you'll cycle on for 1 to 2 months and then you'll cycle off. Give your body a break for a few months and then you can cycle back on again.
Yeah.
That's usually how it goes with peptides.
Yeah. And so, this is pretty typical of peptides, right? They're basically degraded by the body quickly. So people are doing daily or near daily injections.
Yes. Injections, topical. I've heard of transdermal, not transdermal, sublingual, but I don't have much experience with that.
Yeah, I have seen, apparently people are marketing oral GHK-Copper products. So there's sublingual, if you let something absorb, in your mouth. For GHK-Copper or any other peptide, but GHK in particular, is it likely that the oral route's going to work really well, that GHK can actually survive the stomach and the gut and all that?
Well, if it's sublingual, it actually bypasses the gut. It goes directly into the bloodstream because it's sublingual. So if it's a pill that you swallow, that goes through the stomach, and has very low bioavailability. Just like any supplement that you take orally is very low bioavailability because you're going through the gastric acids, the gastric juices in your stomach. And that's why supplements, you have to usually take them on a daily basis versus like IV, you can do like once a month, etc. But again, the issue is that there's just no studies, no human studies. It's just people will just create these products and other people will take them, but there's really no studies to say how effective they are or not. And it's a shame because I know copper has so much potential and there should be, because it has a lot of potential for a lot of different, not just aesthetics, but cancer and diseases like chronic lung diseases. Oh, and I forgot to mention, there's a lot of studies on the neurological benefits, like diseases like Alzheimer's, Parkinson's. There's a lot of studies out there talking about the benefits of GHK-Cu in these diseases.
And so walk us through what would be like a typical example of someone who comes in and you recommend GHK-Copper for them, topically administered or otherwise. When would you sort of recommend GHK-Copper rather than some other skin treatment?
I think I really haven't seen any negative side effects from GHK, Copper in any skincare. It's very well tolerated. And that's the thing about peptides. They're in general well tolerated. I haven't seen any allergic reactions. I haven't seen, and this is just peptides in general. In general, they're pretty well tolerated for almost everybody. So I wouldn't know why I would not recommend it. There's really not a reason why you would not recommend GHK-Cu.
Okay, so you're
unless somebody has.
You're not saying a whole lot with respect to side effects, injection site reactions, things like that?
There is injection site reaction. If you do inject it, it does sting, but it goes away.
Got it. So
the initial, the initial.
I want to ask you really concretely too, when people inject this, what does it look like? What is actually being injected? Is it what is the solvent that the peptide is actually dissolved in? Is it water? Is it something else? Bacteriostatic
water. You usually mix it with bacteriostatic water, and the peptide itself is usually blue.
Got it. Yeah, it does have this
And
quite interesting, vibrant blue color. I've seen it.
mhm,
So basically,
yeah,
bacteriostatic water, you're basically just sterile water.
yeah. Bacteriostatic is, I think, is a little bit different than sterile water, but yeah, yes,
So injection site reactions tend to be mild and they tend to be transient.
yes, yes. But specifically, out of all the injectable peptides, I think copper is the one that stings a little bit the most.
Got it. So that's relatively common, a little bit of a sting.
Yes. And then overall, it's well tolerated. And no, I haven't seen any systemic. But again, I haven't done any studies on it. This is just what I've observed short term.
Yeah, yeah. And like give us a sense for, I mean, how many people out there, I mean, are you noticing a lot more people using GHK-Copper and peptides in general for skincare, or is this a pretty niche thing that not that many people are doing? What is your sense of that as a clinical person?
It People are using it more and more and more every single day, especially in combination with other peptides. There's a lot of different sort of combos that people are approaching me about, like Glow and Clo. Let me see Glow. See, I don't even know all the combos because it's just sometimes I feel like it's
Yeah, there's just so many combinations of peptides and new ones all the time.
yeah, like the GHK, BPC, TB500 combo, and then the Clo, which I recently somebody told me about, which is the BPC, TB500, GHK, and KPV. So yes, there's a lot of different people are on it more and more every single day for sure.
And how common is it for people to use this for and see benefit for hair growth purposes? Are people like literally using this to help their hair grow back in after they've started to go bald, or how are people using it in that regard?
They're not using it as much as they should be. They should definitely be using it more, I think. Studies show that it can be just as effective, if not more, than minoxidil. And minoxidil has probably more side effects than GHK-Cu.
What is minoxidil?
Minoxidil is the medication that's used for hair. You can take it orally or you could also do it topically, and also it can treat blood pressure as well. It's an oral FDA-approved medication, but also it's topical, and they also have it in a foam option as well. But actually, I think it's also known as Rogaine. I'm sure you've heard of that.
Oh yeah,
Rogaine?
Okay, that's Rogaine. Okay, got it.
Yeah. So minoxidil, I guess it can cause like low blood pressure if you take it orally. Both men and women can use it. But I think copper has less side effects, negative side effects.
Yeah. And so, we mentioned earlier, peptides generally have a short half-life. So, when you're cycling a peptide or using a peptide, you might be using it for some number of weeks, but injecting relatively small amounts on a daily basis or, majority of days per week. Can you say a little bit more about a dose response and anything that we know there? You said the doses are not standardized, but do people use a wide range of doses or relatively narrow range? Do we see different effects with different doses, or is that unknown?
I think for humans it's unknown. There are some doctors that have created protocols that people follow, but I don't think there's studies specifically looking at human dosing. I think a lot of the studies are through mice, and that's the issue. But in general, it's like micrograms per day, like 100 micrograms, 200 micrograms per day for like 5 or 6 days a week. Depends. Some protocols are a little bit more aggressive. They want you to inject it twice a day, and you'll do it for like 2 months, 5 days a week, 6 days a week. But there's a lot of confusion out there because it is confusing because there's no standardization for sure. Some people are injecting things daily into themselves, and some, are just continuously on it. So,
yeah,
I guess standardization would be very helpful.
Yeah. So, on the one hand, you've said some of these things are not FDA approved, injection of GHK. Peptides are a little bit up in the air right now. A lot of people are using them, even though they're not, officially approved in different ways. The laws and regulations around that might be changing in the near future. Given all that, but given also that GHK-Copper in particular is a natural peptide, our bodies make it, they're set up to handle it, so to speak. how much risk reward, like how would you advise someone out there who's curious about this type of thing in terms of risk reward? Is this a relatively low risk thing to try because it's an endogenous compound, because it's broken down relatively quickly and you can get, quick feedback on it? Or is there some risk to these things right now?
It's just, I'm like scared to even give it, because I feel like it would become medical advice if I, say anything specific. In general, I mean, how do I word it exactly? Because, people are injecting every single day. GHK-Cu. Would I say, in general, studies have shown peptides are not all peptides, because there are some peptides out there that I would stay away from. And then there are some peptides that can have serious side effects. Based on the studies that I've evaluated, it appears to me that GHK-Cu can be considered one of the safer, less immunogenic, less side effect peptide out there. But this is just based on the research that I've done, not based on study. Okay.
Yeah, that sounds fair. That sounds totally fair.
Okay.
What are the ones that you would stay away from, clearly?
Well, the one that scares me the most is melanotan 2, the one that causes like tanning in the skin.
Yeah.
Some people swear by it and say it's super safe, but it does darken the moles of your body as well. And there's case studies linking it to melanoma. So that's what I'm concerned about.
Got it. So, it's kind of like the Wild West right now. A lot of people are using these things. Yeah. There's some research, but maybe not big clinical trials. Yeah. It's kind of a gray area. And, there could be risk there. We don't really know how these things work, at least some of them on a deep level. And some of them are potentially having like quite profound effects.
Yeah, exactly. And you hear things like, and I don't know if it's true, but I heard about people injecting peptides that were unregulated and people going into anaphylactic shock. I've never seen anyone experience that or had anyone or know of anyone, but I've read about it on the internet, and I don't know if it's true because it was like more on social media than it was in the news. So I don't know.
Right.
Instead of like the FDA banning it, there should be more regulation and studies, because people are going to use it anyways. They're going to use them anyways.
Right.
So there's no reason to like start banning things and making things difficult to access. For example, like I have been researching GHK-Cu for quite some time now, and I have been posting about it on my social media with like sources backed up and lots of it's all like from legitimate sources, legitimate scientific sources. And for whatever reason, Instagram didn't like it, and they've like kind of blocked part of my account, which makes no sense to me.
So let's think back about GHK-Copper topically, and let's just assume we're talking about someone who's going to buy a GHK-Copper topical product, a cream of some kind, online. So they're not necessarily going to come in and get a procedure from someone like you, microneedling or whatever. They're buying these things online. There's many products with GHK-Copper in them. There's different ones out there, different concentrations, different formulations, and so forth.
Yes.
How much variability do you think there is out there in the quality in terms of how well the GHK will penetrate? Could someone just kind of get any GHK-Copper cream and it will probably be reasonably well effective and absorbed? Or is that going to vary a lot depending on the particular product and brand that they actually...
Yeah, of course. It's going to definitely vary, like the way the product is made. If it's made more lipid soluble, what other ingredients are in the product that can help the copper penetrate into your skin. So yes, for sure. I mean, there's so many products out there. It's hard to, I wouldn't even know where to begin to, I just have to specifically look at the product itself and look at the ingredients and see if this product is good or not. But there's so many products out there.
Yeah. Are there any indicators in that regard? Like you hear about micronized products, you hear about liposomal products. Like, are these things people can look for and should look for on the packaging?
Liposomal, definitely. There's studies that show, and I think that was in my article too, where there's for wound care, Liposomal encapsulated GHK-Cu has been shown to help with wound healing. So that's definitely a good term to look at.
And that basically means like the GHK is sort of wrapped in a little bubble of fat, right?
Exactly. So, and then that can penetrate better into the skin. And I think a lot of the skincare out there has it like that, but I can't be sure. I'd have to look at the labeling and see how it comes.
Yeah, yeah. And just to repeat something I think we mentioned earlier, there is evidence in the literature apparently that GHK-copper and hyaluronic acid pair well together, basically.
They do pair well together, exactly. And then there's studies that show that GHK-Cu can actually be as effective, if not more effective. But yes, they're very synergistic. They work very well together. So combining GHK-Cu with a hyaluronic acid will be very effective. And I've actually used products like that. There's some K-beauty skincare products out there that combine the two that I've used in my practice and on myself as well.
And it makes a lot of sense that, when you look at some of the mechanistic data that I read in your article that you referenced, GHK-copper is helping with oxidative stress. It's basically acting as an antioxidant at some level. It's tapping into gene expression and modulating pathways that are involved in inflammation. Obviously, over time, our body, experiences some amount of inflammation. It experiences oxidative stress. Those things are a key component of aging. And when we talk about skin, we're talking about, wrinkles, blemishes, all the stuff that starts to happen more and more as we get older. When you have people come into your clinic and, they're middle-aged, they're older, they're developing wrinkles, or they have a few wrinkles, things like that, and you're giving GHK-copper to them, either topically or injection, what's kind of like the time course where they start to see benefits? You mentioned earlier that people are going to cycle on injections for 1 or 2 months at a time. Do they start to see effects within a few days or weeks, or does it take longer than that?
Well, it depends on what you're talking about. Are you talking about like GHK-Cu combined with like a microneedling procedure, for example? So usually that requires at least 2 to 3 sessions. And it'll like enhance your results of the microneedling versus if you did just if you just did microneedling without the GHK and you did it with just a basic serum, like just like a gliding serum, like a hyaluronic acid. But I can't give you the percentage of how much more enhanced it would be. If you're doing injectable GHK-Cu, it takes about probably 4 weeks of consistent use for you to notice a difference.
Got it. So roughly speaking, you're talking about a month or so before the typical person really sees differences.
Yeah, you're not going to see things like immediately. It definitely takes some time for anything like regenerative for it to come into effect.
Yeah, I mean, it makes sense.
Yeah.
So what else are you generally seeing like on the ground in your clinic when it comes to GHK-copper, but just peptide therapies more generally with regards to skin health? What are some of like the trends you're seeing in terms of what people are starting to use or request more and the types of specific skin conditions that the peptides seem to be beneficial for?
As I mentioned earlier, a lot of people are doing combo, like peptide stacks. Whether or not I think that's a good idea, I'm not sure yet. I usually prefer my peptides individual, so I know what's doing what's affecting what. What peptides? I really like the growth hormone releasing peptides like tesamorelin. I feel like they're very effective for collagen stimulation as well in the skin, and overall like vitality.
So
it depends.
So with like growth hormone, normally you might think that would be something like bodybuilder type guys are using, but people use it for skin as well.
Yeah, if you use it appropriately, you're not going to look like a bodybuilder. You're going to just be toned, and your skin's going to look better. Your hair is going to be thicker, etc. So, if you're using it like appropriately, like not excessively. But the bodybuilders are doing other things too. It's not just like some of them are injecting growth hormone on its own, which we don't actually use anymore, growth hormone. I mean, that's maybe used for like pediatrics if they have growth hormone deficiency, but it's usually like the growth hormone releasing hormones, growth hormone releasing peptides that
got it. So the difference is
we're using in adults.
Yeah, the difference is growth hormone itself being injected versus a peptide that modulates growth hormone secreting hormone.
Right. You're releasing your own growth hormone.
Right, right. So it's a more
Yeah.
naturalistic pattern of growth hormone secretion
Yeah.
that you're
Yeah.
destimulating. Yeah.
Yeah. Yeah. Yeah. Yeah. Exactly.
And like, obviously, a
So,
lot of people use cosmetics and moisturizers and stuff for their body, but their face in particular. With GHK copper, are people injecting it right into their face? Is that something people do?
um, I've heard of people doing that, but it's more like microneedling and then putting it on topically afterwards. I've heard of people doing that. It's not the standard. Yeah.
Got it, got it. And so when it comes to things like wound healing and skin remodeling, are people noticing like effects there, like literally like scrapes and cuts healing faster, or effects on scar tissue or anything like that?
I mean, yes, it should, and that's what all the studies of GHKCU and wound care are. It's a very I'm not in the wound care world because that's like a whole separate world of medicine, but I'm hoping that they're using GHKCU often because the studies show that it is so effective for wound healing.
Yeah, yeah.
It helps regenerate collagen and angiogenesis, as I mentioned, and you need all of those things for wound healing. You need blood vessels, you need more collagen, you need the hyaluronic acid, you need the vitamin C, you need glycosaminoglycans, proteoglycans. So you need all of that in order to heal the wound better.
Yeah, and as we mentioned, this is an endogenous peptide, GHK copper, and I
Yeah.
mean, in this article that you cite some evidence that it does decline quite dramatically with age. It's going to go down by more than half, comparing like a 20-year-old to a 60-year-old, say. And so, it is
Yes.
one of these things, like so many things that decline with age. So, in some sense, it's the idea here that by using exogenous GHK copper, whether it's injected, topically applied, or whatever, you're basically just restoring some level of what your GHK levels used to be.
Exactly. That's exactly what we're trying to do.
Yeah. And do you see,
Yeah.
is there, do you, we've kind of talked about this a little bit, but do you see any risk with, say, chronic, very long-term use of topical GHK for months or years at a time? Or in general, would you cycle it on and off no matter how you're actually administering it?
I I don't think there's any harm with topical long term use, although there's again not too many like human studies, but it's so well tolerated. I've never seen a reaction. Maybe there are reactions somewhere, someone's seen one, but I have not, and have not heard of any. But in general, with peptides, it's good to cycle on and off. And it's good to do that with skincare in general, with supplements, so your body doesn't, kind of get used to it and maybe not process it as much. But specifically peptides, you want to cycle on and off. But I don't think that it's not like a steroid cream where, like, if you're chronically using it, it can thin your skin. If anything, it'll probably maintain it.
What
So
I mean, what would you like to know more about GHK copper in terms of what clinical trials might show us, in terms of effectiveness outside the skin, in terms of how it's working?
yeah.
What, like, in terms of the research direction that you would like to see, what do you think is top of mind there?
I really want to see more of the neurological benefits because there seems to be a lot. So things like Alzheimer's, Parkinson's disease, I'd like to know how it can benefit patients with cancer or potential cancer prevention. Those are really, really important areas that I think if we can, use copper as a therapy, why wouldn't we? It's well tolerated. It's easy to use, and it has so many different benefits. Like versus like more traditional like pharmaceuticals that usually have more side effects. So it would be great if there were more studies on those areas. I mean, aesthetics are really important too, because your skin is your first line of defense from the outside world. And it's not, to me, aesthetics is not about like just vanity. It really is like, if you keep your skin healthy, the rest of your body remains healthy. And that's just like a fact. As we age, everything breaks down in the skin. So if we can keep the structure of the skin, then we'll, keep external insults from entering the body and keep ourselves as strong as healthy as possible.
Yeah. And it sounds like, in general, sort of what I'm getting from you is you are, appropriately cautious but optimistic about peptides. GHK seems to be particularly interesting and low risk relative to some other things that you might advise people not to try quite yet. But what's your sort of general take on the whole realm of peptides? Are you cautiously optimistic? Do you think there's a lot of potential here? Is it overhyped? What's your general take on this area?
I love peptides. I think I'm definitely optimistic, but I think there's a lot of misinformation out there. I think that peptides have been, over the past few years, like they've just blown up so much. They're never going to leave. So a lot of times people, a lot of doctors out there don't know about peptides and they're like very negative towards them. That's the wrong thing to do because patients are going to be using peptides now indefinitely. So a lot of providers need to be more educated in what peptides are, the benefits, and which ones are actually safe versus not. And a lot of providers make it like a blanket statement, like peptides aren't safe. They're not FDA approved. Well, that's wrong. I just hope that there's more research out there on like human studies on these peptides so that, there's more of a general consensus and there's more of like an approval through the medical community so that, people can use them and feel more safe.
Yeah. For GHK-Copper, have you used it yourself?
Yes, I have.
How do you use it? Do you currently use it? Is it topically applied? How do you do it? Just out of curiosity.
I've done both injection and I've done topical, and I've seen benefits with both. The most recent was topical. It was a K-Beauty skincare brand that combined copper with hyaluronic acid and I believe niacinamide, and it was a serum and it was amazing. It was excellent. I used it all. I kind of want more. I used it all super quickly. It was just such a good serum. It really works really well. But yes, I've definitely used copper.
Yeah. Is there anything that you want to reiterate from our discussion today or any final thoughts you want to leave people with about GHK-Copper peptide in particular, and then just skin health in general? I guess more like about peptides in general. I'd like to say, the world of peptides is definitely emerging and physicians need to get on board because patients are already there and they're going to get the peptides. And no matter what, they're here to stay. So we need more studies out there supporting its use in humans. And GHK, I encourage everyone to at least try out some skincare with GHK. And there's a lot out there. I don't have any specific brand that, I'm promoting at the moment, but there's a lot, and just try it out and see because it's usually well tolerated. Yeah, so pretty well tolerated, not a lot of risk to topical application. Maybe things like the liposomal encapsulated products that are probably going to penetrate a little bit better. And then it sounded like you want to try these things for at least about a month or so at a time before making final decisions.
You definitely want to use it for a month or so. And if you're doing topical, I encourage you to do it with microneedling or fractional laser or some sort of like skin procedure that kind of compromises the barrier so that the copper can penetrate deeper.
All right. Well, Dr. Rahi Sarbaziha, thank you very much for your time. I know I only had you for an hour because you've got a new baby at home. So congratulations.
I do. Yeah. Oh, thank you. Thank you so much.
All right. Have a good day.
Take care. All right. Bye-bye.
Hey everyone, a great way to support my efforts is to visit my support page at mindandmatter.substack.com. A link to that page is in the episode description, or you can search for it on the Substack page itself. The support page has an up-to-date list of my affiliate partners. These are companies I work with, and if you buy those products through those links or using the discount codes provided, those will get you a great deal on a variety of products related to optimizing physical, metabolic, or mental health and vitality. These are all products I use myself, and some of them are directly related to podcast episodes or formulated by Mind and Matter guests. For example, there's a great product called Keto Citra, formulated by a kidney biologist who is on episode number 186. It contains the ketone body BHB together with several minerals in a precise ratio formulated with kidney health in mind. There are also links to products like physical technology devices to track your metabolic health, digital applications to help you find and learn about food and consumer products, and more. One product I use every day is the AquaTrue water filter. I recommend this to everyone because it gets everything out of your drinking water: heavy metals, microbes, endocrine disruptors, microplastics, you name it. Other charcoal or gravity-based filters that a lot of people use don't get everything out, they just get some of the stuff out. So I really like the AquaTrue product. You can look for a link to my affiliate partners on my support page or directly in the episode description to this episode, or you can go to mindandmatter.substack.com to find it there.